Hello, my wellbeing buddies. It's me, Steve, the mental health nurse, and we're going to look at hoarding in this section. So, we're going to discuss what hoarding is. We're going to look at some of the risks. We'll look at how hoarding is assessed, some of the treatments, and some of the medication options. So, a couple of years ago, I worked in London as registered manager for a domiciliary service, and we obviously go into people's homes and we assess and treat there. And I've seen hoarding many times, but never quite like this one time. I went to a home, I knocked on the door, and I could hear a voice inside. So I looked through the letterbox. I couldn't really see anything. It was quite dark. Again, I could hear some shouting, so I thought I'll give her some time. When this person opened the door, they wouldn't let me see into the house. So it's very much on the pavement conversation. As I then said to them, is there anything I can do? How can I help? Blah, 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 blah. We built up a bit of trust. And in that time, she opened the door and I could see the house. I kid you not when I say the hallway from floor to ceiling was filled with bin bags. And she then let me in. So I climbed up over some of these bin bags and I looked to the right of me where there was a front room. And in that front room, there was just rubbish, floor to ceiling. And what she had done, she had made herself a bed on top of everything, and there was an electric fire sitting on top of all of this rubbish, which ultimately terrified me because it was getting cold. I then said, look, how would you go to the toilet? Where's your bathroom facilities? So we surfed over the top. I crawled over the top. I could literally touch the ceiling. We surfed over the top and I could see what was meant to be a spare bedroom. The spare bedroom was full, floor to ceiling. What I could see was a kitchen, but I couldn't see the kitchen. I just assumed it was the kitchen because I could see the top of a cupboard. And again, the bathroom, because it was a smaller room, I could see a light. So obviously what had happened is this person had got themselves into such a severe state, they were self-neglecting. And there comes a time when that level of hoarding becomes a hazard to the person, to the environment, and to the people in the buildings, both sides of them. So in extreme situations like that, obviously we had to take some real critical emergencies, and having this understanding of hoarding was really important. So we'll go through it and we'll explain what we did. So hoarding then is a mental health disorder characterized by the difficulty of discarding or letting go of possessions, regardless of their actual value, whether they're perceived to be an item or not. And generally what happens is they're saved due to strong emotional attachment to them, meaning everything you touch has a real value to that person. Hoarding can lead to an accumulation of clutter and possessions, which interferes with the daily living space of the person, and it can cause serious distress. It causes impairment in social activities, occupational, and other areas of functioning. So at this point, we've got a really clear definition of what hoarding is. Hoarding is often associated with other mental health conditions, OCD, ADHD, and depression, including events triggered by trauma. And we know that we need to be trauma focused. So we want to make sure that whatever we're doing, we're not going to make something worse. Because if I'd have started to take that rubbish outside, I potentially could have triggered more trauma, and that would have made it far, far worse. Hoarding is a serious problem and has serious consequences to health and safety, including falls, fire, and poor hygiene, which is what I saw all in that situation. All of that leading to financial problems and legal issues. So hoarding behaviour has a huge amount of problems for people, landlords, animals, and all of that other stuff. Treatment for hoarding normally involves lots of different things, and we'll talk about that in a minute. So the risks then are around physical health. So physical health meaning you can't wash properly, you can't do waste elimination properly, you're not eating properly, and again, it's a fire hazard and a hazard to trip and fall. So lots of issues there. Again, leads to respiratory problems, COPD, asthma, and things like that. Mental health there around depression, anxiety, social isolation, embarrassment, and other issues there. Clear problems around relationship strains. When you watch these programs on Channel 5, I'm a Hoarder and all this stuff, you can see the strain on the family, and it's incredibly difficult. There are financial risks because it means people are using their money on the wrong items, and therefore they're not keeping the key to the building, they're not potentially paying the bills because they're buying things that they don't need. And then finally, it puts you at legal risk and consequences. And ultimately, that was one of the things that we had to do with this particular lady. We had to ring the fire department. They had to come out and issue a fire notice for her well-being and for the well-being of others. Yes, indeed, that was risk versus benefit, but ultimately the mental health team then had to come out and do an assessment as well to see if this person had capacity. So it can get quite tricky quite quickly. Equally, we have to decide, is it therapeutic? Is it an area where we can go in and operate and provide additional support? And if it's not, then further work needs to be done. And that's a multidisciplinary approach. So how is hoarding assessed? Well, we have what's called the Hoarding scale. You can download this online if you Google the Hoarding scale. Basically, you've got pictures from 0 to the area's nice and tidy, to maybe 1, there's a little bit of rubbish and stuff on the floor. 2, you can start seeing things piling up. 3, you start seeing lots of piles everywhere. 4, it's going floor to ceiling. 5, you've got now tunnels being made out of stuff. 6, I think it's you can't see. And 7, you can't even put one more thing in there. The whole lot's going to come out. So it gives you an idea, visual idea of that scale. And that's really important. Equally, around the clinical interview, there has to be some kind of assessment around their mental state and their capacity and their understanding. So again, we'll talk about that. Physical examinations, it's really important that we get to do that health check piece because there's probably a lot going on there. So that definitely needs to be done. Vital signs, bloods, etc. So just to make sure that that person is functioning and well. Bit of psychological testing, looking around cognitive functioning, personality and emotional state. So is there an undiagnosed neurodivergent? Is there maybe some ASD, autism? Is there ADHD? Is there OCD, that obsessive-compulsive part? If there is, that needs to be treated. Equally, some family history is really important here, looking at some of that behaviour. What you might see here is some abandonment issues, this attachment theory. So if you can see abandonment and attachment, that could be related well. And then finally, we obviously have to do a home visit. We have to see what the living environment's like. So the criteria for diagnosing hoarders looks then at difficulty discarding possessions regardless of their value. And it's about that strong emotional attachment to each item. For them, that's a very real thing. It looks at impairment in their social life, impairment in their occupational, and impairment in their daily functioning. So it's important to know that the assessment process for hoarding can be complex and therefore it can be quite timely. So if we move then on down to the treatment there, cognitive behaviour therapy is going to be the way to go. We need to understand those thoughts. Why do you feel this piece of paper has a feeling or an attachment to you? We can then look at those feelings connected, and then we can try and look at that behaviour. So some CBT might be worthwhile there. It may be a piece around trauma, so then we might have to try some EMDR, or alternatively, if it is a self-neglect behaviour, then we might need to be doing some dialect behaviour therapy. So depending on the type of thing there would potentially give you an outcome there. Because of the mood, because of the anxiety, because of the stress, we may then want to consider natural treatments for this. So again, B6 functioning, omega-3s, vitamin D, because there may be a sunlight deficiency and a bit of SAD going on here. There may be some practical interventions such as organisation skills, decluttering, managing risk. And it might be the case that we can try and do some exposure therapy, potentially clear one area, and then build that out. So this is going to be done over a long period of time. And equally, it's about that supportive care. What we know is if we declutter too quickly, we can trigger that fear, and then ultimately we can make it twice as bad. So the home just fills up even more. So medication for hoarding, looking at a prescribed medication then, is really down to the individual, so looking at what's going on. So antidepressants may work particularly well. So the selective serotonin inhibitor uptakes, the SSRIs, have been shown to be helpful for hoarding. However, other medication, it's not typically recommended, but there are other treatments out there that can be used in conjunction with psychotherapy and therapy, and that might be things like mood stabilizers, etc. But again, that would be down to secondary care to have a think about. It's important to note that medication is not the cure for hoarding. It may help just to alleviate some of those symptoms. You know, you might need something to help manage sleep, you might need something to help manage anxiety, and something to help manage that daily function around that depression and low mood. The treatment for hoarding is typically a long process and requires lots of ongoing support. So you are probably going to have to do a referral to your local authorities. You're going to want a Care Act assessment. You're going to want a social worker to go out and assess risk. You may need the fire department to go out. They may need to assess the risk based on the risk of fire and hazards. You may need an environmental health order. They may need to go out and do some environmental stuff. I went to one property once and the person was collecting cats. Unfortunately, that was dead or alive. So ultimately, it is a clinical decision that requires a lot of judgment. We have to go down this positive risk-taking route. Does the risk outweigh the benefit, or does the benefit of hoarding it outweigh the risk? And we have to accept unwise decisions. But ultimately, if it is a hazard, then that needs to be managed. And then what we're probably going to be looking at is a capacity assessment. Does the person have capacity? Are they able to understand the risk associated to this? And then we may need to do a mental state examination as well as part of that. So that MSE, mental state examination. And again, we'll do a video on that. Anyway, that's all about hoarding. Go online, have a look at those hoarding pictures, get an idea on those scales. Have a think about your strategies, look at your points of referral, and hopefully it gives you some idea on how you can manage the risk of hoarding. Anyway, my name's Steve. I'm the mental health nurse. Please like and subscribe. Take care. Bye for now.